Oh my gosh. Oh my gosh.
One more. So, I was looking at your chart. I saw you're having some neck pain and stiffness.
Yeah.
And you've been to some other chiros, is that right?
Yeah.
Yeah, okay. Well, let's do this. Let's just start by seeing how well you're moving, and then we'll go from there. So go ahead and sit up tall for me. You're gonna bring your chin down to your chest as far as you can. Okay. And then look up to the ceiling back as far as you can. Okay. Look over your right shoulder as far as you can. And then your left. Okay. So we're definitely restricted going to the right, not turning there very well.
Yeah.
Definitely stiff coming down too. The other movements look okay. So I'm going to do a couple of movements with your head and neck here. And then while we're doing those movements, I just want you to tell me if anything is painful or if you get any of the symptoms that you're kind of talking about with the shoulder and the neck, okay? So let's have you scoot over a little bit to the left. Perfect. So I'm going to press down on your head. Does this make anything feel worse? No. If I lift up, tell me if things feel better. I'm going to kind of move your earrings.
Yeah.
It feels relief? Okay. If I go here, does that feel worse?
No.
Okay. And what about if we go here?
Yeah.
That feels worse? Okay. All kind of on that right side mostly. Okay, I'm going to turn you a little. Yeah, I feel very tight right there. And here too. Okay. Definitely tightness in the back and ribs too. So, all right, so what we're gonna do is we're gonna do a couple adjustments here. The first one, I'm gonna hop up on the table with you. It's that occipital lift that you were talking about that you had seen. Scared? Yeah. I'll walk you through it here. So, it's not as crazy as it looks. Basically, we're gonna go the way that you have more comfort turning first, because we're okay right here, right?
Yeah, not as bad, but a little bit.
A little bit bad, okay. So my hand's gonna come right back here. Good. I'm gonna tilt you a little. Good. Okay. Try and relax this shoulder here as much as you can. Good.
Oh my gosh. That was crazy.
Does that feel okay?
Yeah.
Yeah?
That was good. Yeah.
Okay. So now we're gonna do the same thing on the other side. Now I know this side's a little bit harder for you turning to. So we're gonna try and take it nice and easy. Now the hardest part of this is probably just gonna be this tilt. So we're gonna go here. Good. You're doing great. That okay right there? Okay. Loose on the shoulder. Yeah. Okay. Doing it right there?
Yeah.
Not awful?
No.
Still alive?
Yeah.
Okay. Let's have you lay on your back for me now. Perfect. And let's scoot you down a bit. So we're going to scoot you way down on the table. A little more. Right there. I'm going to go right here. My hand's going to go underneath you. So we're going to take a big breath in and then blow it all out.
Oh my gosh.
One more. Breathe in. Okay. All right. Doing okay there?
Yeah.
Okay, we're going to try one more here. It's a little decompression with the towel. So, we'll have you lift your head up and then set it down. Good. Now, if I pull here, that feels okay? Okay. Breathe in, out. Good. Nothing too crazy there. I'm going to do a little bit of work on you, on the muscles, just to calm everything down. So let's have you sit back up and face away. Perfect. So I got pretty good releases through everything there.
Yeah.
I'm just going to do a little bit of work in these muscles to calm things down.
Do you know what it could be?
It seems like it kind of jammed that joint up a little bit, and then the muscle spasms when that happens. And if you can't ever clear that joint or get a really good release through there, that muscle spasm kind of just keeps coming back. Because there's lots of little joints in the neck here, So if you could imagine, like you're going in, you're getting adjusted, and they're kind of getting close,
Yeah.
but not actually getting the joint. You'll feel some relief, but if it's not fully resolved at the joint that's stuck, it's just going to keep coming back.
So what would be the next option if it's still...
If we can't get you relief that lasts over a couple of sessions a year, you know, we could look at potentially...
Oh God, that's way better.
Yeah.
Oh my gosh. I haven't done that like in 6 months.
Yeah, I think we're going to do just fine with you. But if for some reason this didn't work, we can look at other options. So there's things that we can do with pain management. You know, you could get some injections or something like that and go down that road.
Okay.
But I don't think that you're going to have to go down that road.
Okay.
So,
Awesome.
yeah. Let's have you come have a seat back here in the gray chair. And we'll take a look at some of those motions again. I know you just did it on your own, but let's have you sit up tall, chin down to your chest as far as you can. Good. Look up to the ceiling back. Look over your right shoulder. Good. And then your left. And how's that feel compared to before?
Way better. It's still there a little bit, but not as painful.
Not like it was.
Yeah.
So, you know, things moved pretty well. I think that you're going to do well with care here. We are going to take kind of a similar approach where we'll see you once a week for a couple of weeks.
Okay.
But generally with something like this, I'm going to want to see you maybe about once a week for 6 visits. And at 6 visits, I'd be expecting you to feel 50%, if not 100% better.
Yeah.
And then from there, we might take you down to something like once a month, just depending on how you feel, just to make sure it doesn't come back.
Yeah.
But yeah, we're not going to do like once a week forever,
Yeah.
just for a couple of weeks. So does that sound okay to you?
Yeah.
Okay.